So you're announcing today that you have delivered 1,500 new GPs. Is that a net addition?
Yeah, we said we would deliver 1,000 more GPs by the end of March. We've actually delivered 1,500 with 1,503. So I wouldn't for a moment say to people watching, job done. You're going to find it miraculously easy to get a GP appointment now. But this is undoubtedly a step in the right direction to reverse the decline we saw under our predecessors, to start fixing the front door to the NHS in general practice. And it follows the recent news that we've signed a contract with GPs for the first time since the pandemic, which will also enable new things this year, like consistent online access for everyone in every part of the country. So I hope this reassures people that step by step, we are getting the NHS on the right track. We're cutting waiting lists as well. And I hope that against the sort of the cynicism that people feel about politics, politicians and government, that people take some quiet confidence and hope that we are delivering what we said, that we are getting the NHS on the road to recovery, and that over the course of this Parliament we will deliver the change that people voted for at the last election.
That said, we're talking to the King's Fund later on, and I'm sure you saw their latest survey. 59% say they are very or quite dissatisfied with the NHS in 2024. That number was up from 52% the prior year. I guess highlighting that there is a lot more work to be done.
Absolutely, Wilf, and that's why when NHS waiting lists fell 5 months on the trot, including peak winter pressures, I was keen to do two things. Firstly, to tell the public that it is improving, but also to reassure people we're not complacent. I mean, there's still more than 7 million people on NHS waiting lists, so there is still a mountain to climb. Similarly today, I want to reassure people that we've not only delivered the 1,000 more GPs we promised by the end of March, we've gone even further, but also reassure people that we know there is much more to do to make sure that everyone can get a GP appointment when they need one. This week, people will also be reading in the newspapers and seeing on the news other announcements. The Prime Minister announced yesterday a new health data research service so that we combine brilliant British science with our NHS to drive that revolution in life sciences and medical technology. We're piloting a new model of neighbourhood health, providing care not just closer to people's homes, but in people's homes, reducing the number of attendances at A&E, for example, by getting people the right care in the right place. All of these things are still at the early stages. We've been in government for 9 months now, but I hope people can see that we are walking the talk when it comes to the commitment to investment and reform that we talked about before the general election. We're now walking that talk in government, and over the course of this Parliament, step by step, week by week, month by month, we will get the NHS further down that road to recovery so that it's there for everyone when they need it, which is a far cry from where we've been in recent years.
I wanted to touch on the unfolding trade war. It's not just UK-US, of course, trade relations that's in the spotlight. Globally, tariff barriers are going up left, right and centre. Is the UK's access to medicines and medical supplies under threat at all?
Well, I mean, until this trade war erupted, we'd already had issues with medicines production and supply internationally. We are constantly watching and acting on this situation to try and get medicines into the country, to make sure we've got availability, to show some flexibility in terms of how medicines are dispensed to deal with shortages. But whether it's medicines, whether it's parts for manufacturing, whether it's the ability of businesses in this country to turn a profit, this is an extremely turbulent situation. It's unprecedented, actually, in terms of global trade and the steps that the United States has taken. And that's why the Prime Minister's shown leadership on 3 fronts. Firstly, making sure that in terms of US tariffs, the UK is already at the best end of the tariff regime, and we are working with the United States to try and secure that economic partnership, providing support for British industry. We heard the announcements on the car industry yesterday and UK life sciences. And thirdly, this is a government that is going to champion free trade and try and break down trading barriers, not just with the United States, but with Europe and with the rest of the world, so that we can get our economy growing. But this is going to be a challenging backdrop for the British economy, no doubt about that.
Just to clarify, though, so medicine supplies are hit by this?
Well, as ever, in terms of medicines, there's a number of factors at play. There have been challenges in terms of manufacturing, challenges in terms of distribution, and if we start to see tariffs kicking in, that's another layer of challenge. But we watch this situation extremely closely. We work on a daily basis to make sure that we have the medicine supply this country needs. Where we do see disruption to supply, we also take steps at the dispensing end to show the flexibility needed to make sure that people can access the prescriptions they need. But whether, as I say, whether it's medicines, whether it's parts for manufacturing, whether it's global trade more generally, this is an extremely volatile and turbulent backdrop for the country. And that's why the Prime Minister, the Trade Secretary, the entire Cabinet are focused on this and making sure that we're taking the steps needed here at home to protect British industries and Britain's public services, at the same time as on the global stage being a champion for free trade, trying to bring down barriers to trade for our country, but not just with the United States, but with some of our other trading partners, including our nearest and biggest trading partner in Europe.
Wanted to touch on graduated driving licences, which we've been talking about so far today on the programme. This is something that the government is considering or is not considering? No, we're not considering this particular measure. I do understand why parents are campaigning for greater road safety. We know that young people are disproportionately involved in car accidents. You're more likely to have an accident if you're an inexperienced driver too. So I understand the call for action. But we are looking at a wider road safety strategy to improve the situation, to improve safety on our roads, to reduce injuries and fatalities. I think the idea of graduated driving licences would, I think, be a kind of an unfair penalty on young people, but we are open-minded to other measures, and we're considering those in the context of the government's road safety strategy. Is it a disappointment for the government, for the Prime Minister personally, after a pledge he made that the new Hillsborough law isn't being introduced ahead of the anniversary, which is coming in a couple of days?
Yeah, the most important thing is that we get this right. I think this is a really important change in the law for the Hillsborough families, of course, who have won the hearts and the support of the country for the dignified and consistent way in which they have campaigned over many years for justice. But also, as our country's health secretary, this duty of candour is absolutely vital against the backdrop of some of the medical scandals we've seen in our country over the years. The meetings I've had with families during the last 9 months who've been affected by a wide range of NHS scandals, from scandals in maternity services, mental health services, and I'm afraid that too often I have seen evidence of a culture of cover-up and protecting reputations above protecting patients, of trying to obfuscate and frustrate families seeking answers, let alone justice. So this duty of candour in law is vital as far as I'm concerned, not least because there is meant to be a duty of candour in the NHS, but I don't think it is working effectively. So we definitely want to see the law changed. We want to see the duty of candour on the statute books and the Hillsborough law delivered. The most important thing I think that all of us would agree on is it's got to work not just in principle but in practice, and that's why it's taking a little bit longer than any of us would have hoped. But I hope that the sincerity of our position is well understood, and that everyone agrees that we've got to get this right in law so that it actually delivers for families.
Health Secretary, just finally, the world has changed. There's no doubt about that. Should the fiscal rules have some flexibility? Should they be rethought?
No, we're committed to the fiscal rules. The fiscal rules are not changing. We are, of course, looking carefully at the global situation. It is going to have an impact on the British economy. It is a challenging time for the public finances, as everyone knows. That is why this government has, in the last 9 months, taken some decisions which we know have been unpopular. We've taken those decisions because we genuinely think they're the right decisions to get Britain out of the massive hole that it was left in. And of course, we are going to have to take further steps in order to protect British businesses, to protect people's livelihoods. That's why you heard the Prime Minister yesterday announcing a package of support for the car industry, support and new innovation for our life sciences sector, vital for our NHS too, and there'll be more to come on that front. So we are going to be an active government trying to protect our country from a battering by these global headwinds and the trade war that we see, but we're not planning to change our fiscal rules.
Wes Streeting, the Health Secretary, thank you so much for joining us. Good to see you.
Thank you.